Probably the biggest change that's occurred over the last 30 years is the age patient that we're doing. When I started in the 80s, we weren't sure how long artificial knees or hips would last. So we were thinking they shouldn't be done on patients under the age of 65. Now we're fairly comfortable doing patients down to age 40 if their arthritis is severe enough. The modern artificial joint lasts a long time. We think that for most patients it's going to last them a lifetime. And so we're not really that worried about it wearing out. I think that's a big change. The second big change is how fast we rehabilitate the patient. So the expectation in the 80s was you're going to stay in the hospital 2 weeks, and we went very slowly with physical therapy. And over time we found out that that wasn't good for the patient. That the less time you stay in the hospital, the better. And the faster you start your rehabilitation, the better. So on some of the healthy patients, we're doing some patients as an outpatient.